Good afternoon, everyone. I'm Dr. Mahima KAUSHAL from GMCH Chandigarh. I'll be presenting my paper, Effects of Ethambutol on the Ocular Structure and Function in Patients Receiving Anti-Tuberculous Therapy. Tuberculosis remains the leading infectious cause of death worldwide, and the drug-resistant strains remain a major concern. In response, India launched the National Strategic Plan for Tuberculosis Elimination. Ethambutol is one of the FDA first-line agents. However, one of its major drawbacks is its potential to cause irreversible ocular toxicity, the risk of which is dose and duration dependent. So the current study focuses on evaluating the changes in ocular structure and function in the TB patients undergoing the current treatment regimen, considering the increased risk with the current regimen. Moving on to methods, it was a prospective and observational study involving 110 patients who were diagnosed with primary TB and started on antituberculous therapy. They were evaluated at baseline, 2 months, and 4 months. The sample size calculation is as shown. All the enrolled patients received their medication from a single dot center, doing away with any manufacturer bias by ensuring that all the patients received the same potency drug. The exclusion criteria is as shown. For methods, we evaluated visual function by logMAR of best corrected visual acuity, color vision by Ishihara's, contrast sensitivity by space enrichment and online test, and Humphrey Visual Fields 30-2. For structure, we used OCT and visual evoked potential. Strict vigilance was maintained throughout the study. Patients were advised to follow up, to report back immediately in case they experienced any ocular symptoms. If ocular toxicity was found, then upon conjunction with the Department of Pulmonology, we pushed for ethambutol cessation and continued monitoring to look for reversibility. For statistical analysis, we used frequency distributions, means, and standard deviations. The baseline data was compared with that at 2 months, 4 months using a chi-square test, and a value of less than 0.05 p-value was considered statistically significant. For results, the basic demographics are as shown. The average age ranged from 18 to 64 years. The duration of treatment ranged from 5 to 12 months. The p-value of visual acuity and color vision did not prove to be statistically significant for our study. However, as early as 4 months, we noted that at least 4 patients experienced at least a 1-line decrease in the visual acuity by Snellen chart. At least 3 patients displayed disturbance in their color vision. The contrast sensitivity, total, and central spark scores also proved to be significant. The common visual field effects which we came across in the ethambutol induced ocular toxicity patients were peripheral construction in 7.2% of them, paracentral and central scotomas in 3.6% of them, and temporal field effects. The average OCT RNFL thickness showed a progressive decline. The same was noted for amplitude of visual evoked potentials. However, no change was noted in latency. Broadly, the cases which we came across were reversible and irreversible. A case of each category is shown. Such was the case of a 23-year-old female with pot spine who was fine until her 4th month of treatment when she started experiencing blurring of vision. All the parameters also showed decline, but the optic disc was relatively healthy. So immediately ethambutol was stopped, and gradually by the end of 1 year, she showed gradual improvement, and all the parameters also improved. The other group of patients were not so fortunate. Such was the case of a 27-year-old male with pulmonary TB, who after a period of missed follow-ups came back with severely diminished vision and optic disc pallor. And to this date, even after having stopped his ethambutol, satisfactory vision has not returned. In conclusion, this study highlighted the subclinical to clinical manifestations of ethambutol-induced ocular toxicity. Optic nerve atrophy definitely proved to be a poor prognosticating factor, and the drawbacks we came across was not being able to rule out the confounding toxicity offered by isoniazid, and the fact that it was a short follow-up study. Lastly, as a food for thought, might we ask ourselves, in a rush to meet the ambitious TB elimination targets, are we truly claiming victory if it comes at the cost of our patients' vision? Thank you.
Thank you, Dr. Mahima. You followed them up for 4 months or 1 year? You gave some results of 1 year.
Yes, sir. The treatment which they were kept on was for 1 month, but for our study, we collected data up till 4 months. If
Okay.
any patient was followed up to look for reversibility, like for example the representative cases which I displayed, then they were followed up continuously, even till now.
Okay. Were they, you couldn't pick up any difference in any of the baseline parameters between those that improved and those that did not?
Yes, sir. The factors which indicated that the patient would go into poor prognosis was increased age, or having any coexisting comorbidity like diabetes or renal dysfunction.
So that was statistically different,
Yes, sir.
significant?
Yes, sir. Although for the scope of this study and for the paper, I did not go into the
Okay,
depth
but
of
because
all
that's a very, very important thing, because that's the most important learning we would have so that we can prognosticate. So maybe when
Yes,
you're
sir.
publishing,
Yes,
you
sir.
should keep that in mind, because like I said, that's the most important thing we would want to know
Yes.
as treating physicians.
Yes.
So as you said, did you try to divide them as reversible and irreversible, and try to compare the parameters, baseline parameters between the group?
Uh, um, Ma'am, not really. We only categorized and summarized all the patients who were showing actual toxicity, and segregated them from the rest.
Okay, so what percent of your patients showed improvement?
Out of 110 patients, ma'am, 17 patients had shown
Improvement.
no that signs of toxicity.
Okay. Okay. And you did not look at whether those who showed toxicity improved or not.
Yes, ma'am. I'm saying that for this study, for the paper, I did not segregate with how many were reversible or how many were irreversible.
Okay, thank you.
Thank you.
That is out of your scope of your study.
Yes.
You are a resident?
Yes, sir.
Is it
This was my
your
PG.
thesis?
Yes, sir.
Because
yes.
your exclusion criteria is a screenshot.
Yes, sir.
Okay. All the best.